황충쟁 교수는 국립대만대학의 교수이십니다. 지금 현재 노인들 환자들을 주로 보고 계시는 의사이시기도 한데 치매 관련해서 국제학술 활동이 굉장히 활발하시고 대만에서 치매 관련된 학회 활동도 열심히 하고 계십니다. 오늘 우리 장립총회에 특별히 대만에서 작년 10월부터 시작되었던 그런 디멘치아 케어를 좀 일부 소개하시면서 대만의 현재 시스템에 대해서 말씀해 주시겠습니다.
Thank you, Professor Su, for your kind invitation for me to attend this forum on dementia care. I am from National Taiwan University Hospital, and I'm very glad to share with you our experience on dementia care in Taiwan. And today I am going to talk about the following parts. First, I will talk about Taiwan's future population structure, and then talk about a recent epidemiological survey of dementia. And then I will talk about the three major systems in the care of the elderly. That is medical care, long-term care, and the pension system. And then I will spend some time briefly mention two innovative models of dementia care, and then make a conclusion. And Taiwan has been undergoing rapidly aging, and the geriatric population reached 7% in 1994. And then it is estimated that it will reach 14% in 2017, and then reach 20% in 2025. That when a society becomes super aged society. And because the increase of the geriatric population and the decrease of the newborn birth rate over the past years, so it is estimated that right now we are here about 10 to 12% geriatric population, and then by the time of 2056, for every person there will be for every 100 person there will be 52 adults and 38 or close to 40 old people, and then 10%, about 10 young people. So we will find that the adult population at that time would bear a very heavy burden to take care of the old and the young people. And in 2012, we have conducted an epidemiological survey again, and to find out the prevalence of dementia. And compared to about 10 years ago, the prevalence of dementia increased in every age stratum. So that means we are not only getting old, but we also getting more demented for the old people. So almost for every stratum of age, you can see the dementia prevalence increase. And right now it's about 8%. But of course, I have to say that part of the reason is there is increasing awareness of early detection of dementia. And also, this time, the survey criteria become more broad. So we include also very early dementia. So in terms of taking care for the elderly, there are three systems. One is medical system, and the other is long-term care system, and the third is pension. I will talk about mainly these two parts, and this two parts because I'm not the specialist, and right now this part is still ongoing, and we have launched it in 2008. Although the system is still not satisfactory enough, but it is already implemented and keep improving. But I think we are most interested in these two parts. So I will talk about these two parts. First, I will talk about the medical care. Taiwan launched its medical care law in 1986 and formally launched the National Health Insurance in 1995. And in terms of long-term care, we have launched a 10-year long-term care plan in 2008. But right now, there is still no long-term care law or insurance yet. We hope to implement it, to pass the law in 2016. And this slide shows the expenditure of the National Health Insurance. Sorry, this is in Chinese character, but I can explain to you. This is Taiwan, the red color. You can see this is GDP percent. We spend about 6.6%. And compared to this is American, it's much higher. This is Holland, this is France, this is Switzerland. And this is per year, per person expenditure. Also, we are not very high, but the outcome seems relatively good. For example, the basic one basic indicator is infant death rate. This is the data about 3 or 4 years ago. 4 years ago, and this is Taiwan. This is the infant death rate is still quite comparable with all the other developed countries. And this is American, is higher than us. This is Canada, this is New Zealand, England. And the other example is cancer. This is colon cancer, lung cancer, breast cancer. 5-year survival rate. You can see the data is about 10 years ago. It's quite comparable with United States and Australia. And right now, I think the figure is even closer to each other. And the global satisfaction from the population is quite high. This system usually have a satisfaction rate above 70 or even 80. So it's amazing because we spend quite a few money, but we can reach such good outcome. So it was rated as probably one of the best medical systems in the world. But we still pay the price because the medical care system, in fact, are working very hard. I am a physician. I work day and night to make this possible. So the Nobel laureate, Professor Paul Krugman, once said that Taiwan's health insurance system is a model for the United States. But when we look at the elder people population, you can see the cost is quite different. When we see from 1996 to 2008, the geriatric population grows about 38%, but the expenditure, medical expenditure, increased 169%. And by the time of 2008, the geriatric population accounts for 10% of the total population, but their expenditure accounts for 34%, or 1/3. So this is a big problem for the government. But if we look at the dementia patient rather than only geriatric patient, the figure is even more striking because dementia patients only account for about 0.5%, but They cost 8.9% of the total expenditure. We provide a variety of medical care for the elderly patient, acute inpatient care. We think it's still not satisfactory because there is still no medical psychiatry ward, and only a few centers with specific consideration for the elderly dementia patient. For example, in terms of the design of the ward and so on. Usually, most of the wards are designed for adult, and some very few of them designed specific for elderly. But I think there is almost no ward specific design for demented patient. And we provide the emergency services, and we provide a lot of outpatient care. I think this part is relatively better because there is an increasing number of memory clinic, and the Taiwan Dementia Society has set up a qualification system, and we put the name of qualified physicians on the website, so every people can read and can go to the website and to check whether which hospital has some specialist and where to go. And then move on to long-term care system. So we have already launched a 10-year long-term care plan. The plan is with the purpose to set up the first stage of service network for the elderly. So this plan has been ongoing for many years, and it includes a variety of long-term care services. And in 2013, the government have reorganized and combined the health and the welfare system together into Ministry of Health and Welfare System. Ministry of Health and Welfare, and this has been very good for elderly people, especially for dementia people, because usually this kind of people need both health and the social welfare. And what kinds of long-term care services do we have? We have provide professional long-term care services, including, for example, daycare center, nursing home, home care. This is especially designed for some nursing specialists to go to the home to provide some medical help. For example, change of the NG tube or Foley. And we also have group home and unit care, but the number is still quite small. And for less professional long-term care services, we have community activity center for the elderly. So please pay attention, this is not for the dementia patient, this is for the elderly. And then learning center, some of the learning center are provided with service, provide service for the patient with mild dementia. And we have daycare center for patients with mild dementia, but the number is still quite inadequate. And day service to take care of disabled elderly. And the respite services and the home help and the assisted living facility and the retirement home. And other related services including support group for family, consultation for legal issue. There is some foundation, they will provide this kind of consultation, and the services for preventing getting lost. For example, wrist chain or fingerprint records, and a service center for assistive device. And usually this kind of service is provided by local government, and the meal services and the transportation services. And also community mental health consultation services, telephone consultation for dementia. The Taiwan Alzheimer's Disease Association provides a 24 hours hotline for telephone consultation for all kinds of dementia care problem. And there is a few place providing end of life care. And also, last but not least, I think it's very important, is foreign helper, because a lot of family hired foreign helper to take care of their demented elderly. And there's right now 180,000 foreign helper, so it's a lot. So the strength is we have already provided a variety of long-term care services, but and also we have very clear the policy guideline that is formally announced by the Ministry of Health and Welfare. But right now there is a lot of problem because most of the long-term care services are focusing on elderly, but not specific for demented elderly. So the quantity in general is inadequate and also unevenly distributed. And for some area, maybe the quantity is adequate, but it's not specific for dementia elderly, so there's still a problem. For example, in 2012, only 5 group homes in Taiwan. In terms of quality, it's still unsatisfactory because they are not tailored to the needs of demented patients. For example, 78 daycare center in 2011, but only take care of 147 demented people. Why? Because these kind of daycare centers are not specific designed for demented patients. So either family do not like to send their demented patient there, or either these kind of daycare center, they refuse some of the dementia patients with BPSD, with behavioral problem, because they think they are not able to take care of this kind of demented patients. So, so there's a problem here. And right now we don't have long-term care law and the insurance yet. So this is a problem. Now we hope if it can be launched in 2016, that will be good enough. But there is already a research and also a policy making process for this. I think it's more than 10 years, a lot of discussion. And right now the preliminary draft want to cover all the population, universal coverage, and provide basic and affordable, accountable long-term care to achieve the goal of age in place. So this is the goal, rather than just send all the patients to the institute. So the design of this insurance would be designed in such a way to promote age in place. And so there will be more community and home care. This is home care than institutional care. And it is hoped that after this long-term care insurance system set up, it will have a seamless link with the national health insurance. But right now there are a couple of major arguments. One is whether we use social insurance or use taxation scheme. At this moment, most of people favor social insurance. So every person aged above 40, they have to pay the insurance. And then right now there is still a shortage and the maldistribution of long-term care services. So hopefully this law, after its implementation, it will make the distribution more even. And there is also an argument about whether we set up a cash benefit or not. That means for some people, they may argue that I have a demented patient at home, so I don't want to send it to institute, but please give me money so I can take care of him. But right now, most of the people think this is not the way to go because they may not use the money to really taking care of the elderly people. And also, there's a discussion on the premium contribution rate among employee, employer, and the government. And also, there's also question about the long-standing financial sustainability of this system. So this is yet to be solved. But there is some preliminary calculation. And when I look at the figure, I think it's quite acceptable. And then this is very important because right now we have a lot of foreign helper. So people may ask that because I have already hired a foreign helper, so I don't need your government's help. I only need your money. So this is also a discussion. Okay. So in summary, I think we do have long-term care services, but right now the services is still not adequate or not evenly distributed or not very satisfactory for patient or for family. So we are still a long way to go and to further improve this problem. And last, I will briefly mention about two innovative models that I want to share with you. One is a so-called School of Wisdom, the other is Family of Wisdom. School of Wisdom is a kind of class. I think there are maybe a lot of this kind of class all over the world, but this kind is specific design for dementia and with very good results. This kind of class is about, each class is about 12 weeks, and each week 2 hours. And there is very scheduled activity, including music, cognitive training, reminiscence, and art therapy, exercise, and the chorus. So we have already this kind of data, and it shows that this is especially good for people with mild dementia, and they can help them a lot. So usually the leader to client is 2 to 10, and the family are not allowed inside the classroom because when they are enter this classroom, they may sometimes try to help the elderly people, so that they can make the efficacy decrease. And then now it's over 50 schools of wisdom in Taiwan, and then they all receive subsidy from government. And if we compare the usual dementia daycare center with this, the usual dementia care center is like kindergarten. And then this kind of school of wisdom is like an art class. So it's different. And then after using the service of School of Wisdom, we got response from a caregiver. They say, is there any place we can come and join activity together? We don't need staff, just us. So the Taiwan Alzheimer's Disease Association come up with the idea, so-called Family of Wisdom. This is a kind of Shudo family. We provide a place and set up the place, specific design for a dementia patient in terms of safety and the convenience. And then there is no need to have to hire any specialist. There's only one social worker to just provide some necessary help, but she didn't join the activity. So who are the attenders? Each family bring a demented elderly to the Shudo family. So it can up to 40 pairs. And this is a big Shudo family, and they have fun together, they work together, they do everything together. So they can sing, they can play mahjong, yoga, and they cook together, and they buy their food by themselves without fixed schedule. And the environment is quite familiar and meaningful because we have already designed that. So it's like a family. And the first of this kind is established in the house of our former president of Taiwan, because the former president, Chen Shui-bian, has a lot of scandal. So after he stepped down, he was sent to jail. Sent to jail. And his family think quite guilty of that. So they provide their house. This is where the presidents live before. So this is quite meaningful. And let me just show you briefly. This is the activity. You see a lot of people, but there's no worker. They are family and they are patient, and they do everything together. They can cook and they can do artwork and they drink and a lot of activity. This is when they take lunch together. And it's very interesting. When the demented patients stay at home, usually it's one by one. One family caregiver take care of one demented patient. And over time, their relationship become very tense. And usually if you force the demented patient to eat or to go to the toilet room or to take a shower, they will refuse. So sometimes there's a lot of behavioral problem emerge. So, but when they go here, this is a pseudo big family. They don't do that. They become very calm. And then when they see people eat, they will eat. When they see people pray, they will join. And this kind of design, I think, is especially good for Asian countries because there is a high population density, and it's very easy. Now, Taiwan government, we try to persuade Taiwan government to set up such kind of family wisdom in school. For example, in primary school, because we have decreased number of newborn, so many primary schools are now empty. And now we hope to set up this, transform it, become this kind of elderly care center. And hopefully this can come true. I think it's quite convenient. You can just walk by a short distance and go to the school and then have fun there. And by the time you return, it's already late, so the dementia patient will feel tired, and then it's quite easy for them to take a good sleep. And so everything will get better. So you don't need to prescribe a lot of psychotropic agents. So the conclusion is Taiwan is undergoing rapid aging, and there's a comprehensive dementia care system. And a comprehensive dementia care system needs 3 parts. And right now we have good enough medical system, and the other system still is now ongoing and keep improving. And we have some innovative care model, and hopefully this can also help to take care of these elderly patients. So thank you.